Hello everyone, so this is a video on how to read and write an abstract. So if you can understand how to read an abstract, you can then write an abstract. So now we have selected a study published in BMJ 2024. As you can see, 2024 BMJ. And what is the study? Effect of exercise for depression, a systematic review and network meta-analysis of randomized controlled trials. So that is a study, and look at the authors. There's so many authors. These are the author names. If you are learning research for the first time, then just understand that there can be multiple authors. This is the first author and this is the last author. Last author can mostly or many a times be the most experienced person, or the first author can be the most experienced or mentor. So how many people can author an article? It's up to you. It's unlimited. It depends on your load. So this study has these many people. Now let's move forward. Now the abstract begins. See, this is the abstract. Now many of you have seen abstract without headings. So why we have headings here? Because journals can have different requirements. Some journals want structured abstract, that means structured means with headings, and some want unstructured abstract, that means like a paragraph. So it depends. If this journal does not say anything, then it's your choice. So don't worry about it, that why they have written abstract with headings or without headings. Just see what they have written. If an abstract is without headings, it will still have the same information. And if it is with headings, it will have the same information. So not a big deal. So now, what is the first heading of the abstract? Objective. So what is the objective? Why are we doing this study? To identify the optimal dose and modality of exercise for treating major depressive disorder. And they're comparing with the psychotherapy, antidepressants, and control conditions. Now, what is the design? What do we mean by design? What kind of study it is? Is it a clinical trial? Is it an observational study? Is it a meta-analysis? Is it a systematic review and meta-analysis, or is it a systematic review and network meta-analysis? So this is a systematic review and network meta-analysis. Now let's move to the next section, which is the methods. Now this is a third heading of the abstract. So what did they do? They just wrote what they did. They did the screening, data extraction, coding, risk of bias assessment, XYZ, and then they wrote it down, just 4 lines. Now, why did they not write excessive details? Because that's what the whole paper is all about. They will write that in the method section of the whole paper. So remember that. Now, journals can have limits of how many words an abstract could be. That is also one of the reasons. 250 words, 350 words. And if not, then just keep it reasonable. Keep it reasonable. Now then, the data sources, where did they collect data from? Cochrane, Medline, XYZ. So they used 5 databases. Now the eligibility criteria for selecting any randomized trial with exercise arms for participants meeting clinical cutoffs for major depression. See that? Now eligibility criteria, what kind of studies did they select? Now the results, they have mentioned results in a little bit of detail, so that if somebody reads an abstract, he knows what to expect in this paper and what are the actual results if somebody just wants to rely on the abstract, just on the abstract rather than reading the full paper. So yes, this can give very much of relevant information. Now then they concluded. Now if you see the numbers, remember results has the numbers. How many participants were included? How many studies? So 218 studies were included in total. How many arms and how many participants? 14,170. So they have calculated everything. They have added everything. And then the conclusion. Conclusion is exercise is an effective treatment for depression with walking or jogging, yoga and strength training, more effective than other exercise, particularly when intense. Then they said yoga and strength training were well tolerated compared with other treatments. Now the last few lines are, exercise appeared equally effective for people with and without comorbidities and with different baseline levels of depression. To mitigate expectancy effects, future studies. Now see, future recommendation of studies are usually done in the conclusion section. So they have done it over here. And what they have recommended, and that the study could aim to future studies could aim to blind participants and staff. These forms of exercise could be considered alongside psychotherapy and antidepressant as co-treatment for depression. See that? That's how it is written. Now, did they register it somewhere? Yes. So they mentioned that in the abstract. That's the Prospero registration. What is Prospero registration? We'll talk about that in some other video someday, how to register and all. But right now, for this, you understand how an abstract is written. And then the article begins with the introduction section. See that? So you can do it. Trust me. If you have any questions, send me an inbox message. Thank you.